Worm infestation, intestinal. Infestation with worms is very common, and poor hygiene or contact of bare skin and with soil in which the worms or its eggs live predisposes individuals to infestation. Causes: hookworm, ascaris, strongyloides, tapeworm, threadworm, and wingworm. Symptoms are generalized itching, perianal itching, that's threadworm, dry cough when the larvae pass through the lungs, wheeze when the larvae pass through the lungs, abdominal discomfort or pain, easy fatigability, passage of worms in the stool, altered bowel habits, and vomiting of worms. The signs that are usually elicited are pallor, features of malnutrition, poor physical growth in children, large distended abdomen in children, and wheezing. Investigations are stool for routine examination (FBC). The main treatment objectives are to eliminate the worms, to treat the complications of infestation, for example, anemia, malnutrition, to ensure proper sanitation. Non-pharmacological treatment: ensure proper nutrition and proper hand washing with soap and running water. Pharmacological treatment: treat the worm infestations appropriately. So, for hookworm, you give metronidazole oral in adults, 500 milligrams as single dose or 100 milligrams 12 hourly for 3 days. In children more than 12 months, 100 milligrams 12 hourly for 3 days. Note: is not recommended for children below 12 months and in pregnant women. So for hookworm, you can also give albendazole oral in adults and children more than 12 months, 400 milligrams as a single dose. In children below 12 months, 200 milligrams as a single dose. It's not recommended during pregnancy. For ascaris, you can give mebendazole oral in adults and children above 12 months, 100 milligrams 12 hourly for 3 days, or 500 milligrams as single dose. It's not recommended for children below 12 months and in pregnant women. Or you can give albendazole oral in adults and children above 12 months, 400 milligrams as a single dose. In children below 12 months, 200 milligrams as a single dose. It's not recommended during pregnancy. For wingworm, you give mebendazole oral, adults and children above 12 months, 100 milligrams 12 hourly for 3 days, or 500 milligrams as a single dose. It's not recommended for children below 12 months and pregnant women. Or you can give albendazole oral in adults and children above 12 months, 400 milligrams as a single dose. In children below 12 months, 200 milligrams as a single dose. It's not recommended during pregnancy. Or threadworm, you give mebendazole oral in adults and children above 12 months, 100 milligrams 12 hourly for 3 days, or 500 milligrams as single dose. It's not recommended for children below 12 months and in pregnant women. Repeat treatment after 3 days. Or albendazole oral in adults and children above 12 months, 400 milligrams as a single dose. In children below 12 months, 200 milligrams as a single dose. It's not recommended during pregnancy. And repeat treatment after 3 weeks. Or strongyloides, you give albendazole oral in adults and children above 12 months, 400 milligrams 12 hourly for 3 days. In children below 12 months, 200 milligrams 12 hourly for 3 days. Or thiabendazole oral in adults 1.5 gram 12 hourly for 3 days. In children 25 milligrams per kilogram 12 hourly for 3 days. It's not recommended during pregnancy. Repeat treatment after 3 weeks. Alternatively, a 7 days treatment without repeat is acceptable. ivermectin or ivermectin is the drug of choice, but has a danger of precipitating life-threatening encephalopathy in microfilaria endemic areas. For tapeworm, we give praziquantel oral, adults and children 5 to 10 milligrams per kilogram as a single dose, 25 milligrams per kilogram as a single dose for Hymenophipas nana. It repeats in 10 days. That's for the Hymenophipas nana. Or you can give niclosamide oral in adults and children above 6 years, 2 grams as a single dose. So it's taken after a light breakfast. Also, for tapeworm in children less than 2 years, you can give niclosamide or niclosamide oral, 500 milligrams as a single dose. 2 to 6 years, you give 1 gram as a single dose. Chew tablets 2 hours before a meal. The referral criteria: we refer patients with intestinal obstruction from a heavy load of suspected worm infestation to a surgical specialist.